does one begin the epitaph of a man who had his footprint in all areas of life and national development with excellent records? Dr. Benjamin Chukudum Nnamdi Ayene KSA stood tall, and that was why the people would have paid for his death were it possible. On Sunday, December 29, 2019, Dr. Ayene passed on to the great beyond in New York, United States of America. Benjamin had a robust decent education, which peaked at the CMS Grammar School, Lagos, and Oraoku Grammar School, Anambra. He obtained a diploma in science education and research from Porterville College, California, after which he earned a BSc in microbiology and biochemistry from the California State University, Fresno, California. Benjamin Ayene obtained the MBBS from the College of Medicine, University of Lagos. As a student, particularly in the United States, he was like a goldfish with no hiding place. Benjamin was famous, and his impact was felt in every activity, including the contribution of news articles to journals. He also had a stint in his university soccer team, and at the University of Lagos, he was at one time the president of the Medical Students Association and vice president of the Students' Union. Religion had a lot of influence on his upbringing, particularly as a child of a Kafkist. Benjamin, at some point, was a cross-bearer in church. He grew up as a brilliant and active young man who excelled in all that he was involved in. Perhaps the most critical area is the health sector. Dr. Ben Ayene became the Commissioner for Health at a time when Nigeria's health sector was at its lowest ebb. He would later become the head technical committee and, in effect, representative of state commissioners for health on the board of the National Primary Healthcare Development Agency.
Parliament at all levels, CSOs, partners, traditional institutions and religious institutions, the people of Nigeria, all of us are interested in ensuring that we have good health. And if you are to have good health, it's not just by talking or by mouthing it or by whatever it is, it's by doing the hard work to be able to tell the story in such a way that that story can be verified.
Dr. Ayene had the rare opportunity to work closely with Professor Olukoye Ransom Kute. He was later invited to join the UK Department for International Development, DFID Change Agents Program. The focus of that program was on the health sector and immunization reforms. The change agents and the governance group undertook a study tour of Ghana and South Africa to learn their approach to providing immunization services. Playing a pivotal role, Dr. Ben Ayene leveraged on his experience to influence legal and constitutional frameworks to back reforms in the Nigerian health sector.
I always say this: health is the business of everybody. We are all producers of health. We are all consumers of health.
With the approval of DFID, the change agents established the Health Reform Foundation of Nigeria in 2004 with Dr. Ben Ayene as a member of the technical advisory group. He was the lead consultant for the development of the 2004 revised National Health Policy, Revitalization of Primary Health in 2005, National Health Promotion Policy 2007, and Human Resources for Health in 2008. He was instrumental to the reversal of the widespread rejection of polio vaccines in northern Nigeria, as well as the development of strategic plans and programs to achieve national health priorities. Dr. Ayene took an active part in the drafting of the National Health Bill sent to the National Assembly by President Olusegun Obasanjo, as he then was, in 2004. Determined to ensure that the bill become law, Dr. Ayene organized a series of consultative meetings with health professional associations and religious bodies to get their endorsements and support.
28% of the deaths for children under 5 is attributable to diseases for which there are vaccines. And every year, 7 million children are born in Nigeria who require vaccination to protect them from vaccine-preventable diseases. And the immunization program faces a large funding gap owing to new vaccines and transition from Gavi.
As Chairman, Board of Trustees of the Health Reform Foundation of Nigeria, Dr. Ayene engaged with the Senate and the House of Representatives, which led to the passage of the bill that became law on October 31, 2014. It is on record that he led sustained advocacy to ensure that the Basic Healthcare Provision Fund becomes statutory. His impact in the health sector is inexhaustible. This explains why the health community received the news of his death with shock after an unforgettable 35 years in active service. Dr. Benjamin Ayene branched into politics to follow the footsteps of his brother-in-law, former Vice President Alex Ekweme, as founding member of the People's Democratic Party, PDP. It is public knowledge that he turned down the opportunity to become a deputy governor in Anambra State at the time. Dr. Ayene cannot be forgotten in a hurry by his people. He was a philanthropist par excellence who touched the lives of many. He was committed to the education, welfare, and professional aspirations of his people, which he sustained until death took him away. As a knight of the Anglican Church and son to a catechist, Ben maintained a close relationship with God. Dr. Benjamin Chukudum Nnamdi Ayene, KSC, was a good husband to his wife, Lady Ngozi Ni Ufu, a loving father to his 4 children. He was a brother, friend, and mentor to everyone who came across him. He lived a fulfilled life, doing good passionately and resiliently too. Those who have crossed paths with this great man will never be tired of remembering the good works he has done and how well he touched people's lives. At 68 years of age, he has come, seen, and conquered a lot, particularly in Nigeria's health sector. He demonstrated that without courage, there can be no achievement. Dr. Ayene had a lot more to give, had death not taken him away. Good night, Dr. Benjamin Chukudum Nnamdi Ayene, KSC.